This video will explain the information about deprescribing proton pump inhibitors for patients on hemodialysis. So you're probably wondering, what are proton pump inhibitors? Proton pump inhibitors, or PPIs for short, are a type of medicine used to prevent and treat heartburn and stomach ulcers. Some common examples of PPIs include omeprazole, also called Losec, pantoprazole, also called Tecta or Pantoloc, and esomeprazole, also called Nexium. Why should you stop or reduce the dose of your PPIs? Usually, PPIs are only needed for short-term use. Patients on hemodialysis who are taking PPIs long-term for more than 8 weeks can have serious side effects such as infections, such as pneumonia or stomach infections, bone fractures, fatigue and heart problems, and they can cancel out the effect of other medicine, such as calcium carbonate or Tums. Patients who have certain conditions should remain on their PPI medicine, such as patients with severe esophagus inflammation, a condition called Barrett's esophagus, ulcers from an unknown cause, uncontrolled heartburn, or long-term use of certain medicines such as ibuprofen, also called Advil, or naproxen. So we want to reduce or stop the dose of your PPI. How do we do this? If you have been taking a PPI for more than 8 weeks, your healthcare team will help decide the best way for you to stop taking your medicine. This may include lowering the dose you receive for a few weeks before stopping the medicine altogether. There are a few things your healthcare team will monitor for after reducing the dose or stopping your medicine. This includes symptoms of heartburn and antacid use, for example, the amount of Tums you may use. You may be wondering, what can you do if your symptoms of heartburn continue after adjusting your medicine? Firstly, please contact your healthcare team if symptoms return. Your healthcare team may recommend starting a different medicine, for example, ranitidine, or to return to your previous PPI dose. There are also other ways you can manage your heartburn symptoms. For example, you can try to avoid smoking, limit the amount of alcohol you drink, avoid chocolate and spicy foods, elevating your head in bed, and exercising and weight loss. Remember, you can always speak to your dietitian to learn which foods are right for you. Your healthcare team will see if deprescribing is right for you. If it is, you will receive a custom plan on how to reduce or stop your medicine. Overall, the goal of deprescribing is to lead to better patient care. Always contact your healthcare team before you stop or change any of your medicine.